Hi everyone. When I think about evidence-based practice, I'm reminded how often decisions in healthcare are made with good intentions, but not always with strong evidence. So, for example, one hospital started using silver-infused dressings just after lab studies showed antimicrobial effects, but there were no large clinical trials proving better outcomes. So these kinds of choices, they can create confusion when the evidence isn't strong enough to justify a big change. So in my own experience in critical care, I've seen both sides. So some practice changes are well supported by solid research, while others feel like decisions based on limited information. Sometimes they can even be influenced by social media. And when this happens, it can lead to inconsistencies and can impact patient care. So there are real barriers to applying evidence correctly. Time constraints, lack of access to the full text research, and limited confidence in interpreting studies all play a role. So, and some clinicians, they rely heavily on experience. So saying I've always done it this way and it works, which makes it harder to move forward. So to close the gap, we need to build a culture, or we can build a culture that values continuous learning. Things like journal clubs, maybe, and supportive leadership can really help normalize research use in daily practice. So technology has been a huge advantage. It's made accessing evidence so much faster through databases like PubMed. AI tools can even summarize studies in seconds, which helps when we're busy. But at the same time, misinformation spreads easily online. For example, vaccine myths on social media show how false information can really influence even healthcare professionals at the moment. So that's why it's so important to rely on credible sources. So at the end of the day, evidence-based practice isn't about doing what's new or popular. It's about doing what's proven to be safe and effective. So as future CRNAs, it's our responsibility to evaluate the quality of evidence before bringing it to our patients. Thank you.